My name is Matt O'Connor, and I am L&M. I'm Communications Director for AFT Connecticut, a labor federation of unions that include the 3 unions representing the nurses, the technicians, the healthcare workers, about 1,600 strong here at Lawrence Memorial Hospital. You see a bunch of them standing right here today, and we're standing for quality patient care at this hospital, for this community, at this time. We're here to announce the launch of a new public awareness, education, and engagement campaign that we're calling simply I Am L&M. A new website is online that will allow folks in the community to sign a petition to say that they too are L&M and that they stand for quality care at this hospital. We are going to begin airing this week a new public service announcement on the 2 cable networks that serve the region, Comcast and MetroCast. The spot is going to be seen primarily in the evenings and weekends during public affairs and news programming. We're finalizing those details, but we do expect those to begin airing this week. The actual ad is going to be online at the new I Am L&M website, and when we wrap up here, folks are welcome to come down to our joint locals hall at the corner on Converse Place and watch the spot and see a bunch of the great folks who are standing here today talk about why they are L&M. So quickly, I'm going to just run through who you'll be hearing from today so you get a sense of the program and the agenda. And then I'm going to turn it over to our first speaker. First, we're going to hear from Harry Rodriguez, the president of our L&M healthcare workers. Then we're going to hear from Lisa Dabrowska, the president of our L&M nurses. We're going to then hear from Stephanie Johnson, the president of our L&M LPNs and techs. Then we're going to turn it over to Don Wilson, the president of the local NAACP chapter. We're then going to hear from Ocean Pellet from United Action Connecticut, the local chapter here in the area. We're then going to hear from Lori Pelletier, the executive secretary-treasurer of the state AFL-CIO. And then we're going to hear from Melody Peters, the president of AFT Connecticut, and then we'll open it up to questions. So without any further ado, I'm going to turn it over to Harry Rodriguez. Harry.
Good afternoon. If you could repeat after me, I am L&M. I am L&M. One more time. I am L&M. One more. I am L&M. I want to welcome everyone here this afternoon. And I just want to say that my piece today is to let you know that we are serving a community hospital who, in my opinion, is turning its back on the community that they serve and on the caregivers that serve this very community. We've been told that we're broke. We've been told that 6 months ago, the hospital, when they presented their case to the Department of Public Health up in Rhode Island, that they had $250 million, which equaled out to 180 days of cash on hand. 6 months later, we've laid off 77 workers here at Lawrence Memorial to help to pay for the $69 million that was spent at Westerly Hospital. Where is the $250 million? Why are we laying workers off? Why do we have $35 million in the Grand Cayman? I can't figure it out. Can someone tell me why L&M, such a small community hospital, is paying its chief executive officer $761,000 a year, which, by the way, I did the math, comes out to $15,300 a week. And yet we're laying off the lowest paid workers in the hospital. They want to turn around and put 186 families out on the street. They want to shut down the Environmental Services Department. They want to shut down the kitchen workers, the food service workers who deliver the food to the patients in the rooms, all because we don't have the money. Yet senior management, who between 10 people take home almost $4 million a year, they don't want to take any pay cuts. They don't want to lead by example. They've asked every department in a hospital to take a 10% cut, a reduction, whether that's through services or whether that's through personnel. Yet, on Mahogany Row, they don't listen to their own advice. They continue collecting their paychecks. And so today I'm asking you to stand behind the healthcare workers, stand behind the RNs, stand behind the LPN techs, and send a message to the second floor. Send a message to Mahogany Row. Send a message to the carpetbaggers who don't even live here in Connecticut. They live somewhere else, and they're taking Connecticut dollars and spending it in Rhode Island. Tell them that you're tired of it and you want your community hospital back. Thank you.
Hi everyone, I want to thank you all for coming here today. My name's Lisa Dabrowska. I'm the president of the Nurses Union here at L&M. I've worked here for 10 years and I too am L&M. This community hospital here should be in the business of taking care of patients, but unfortunately it's not. It's in the business of undercutting the staff and undercutting the people who care for you. The hospital has been putting profits before patients, and even the labor board agrees with the tactics that they've been engaging in have been unlawful. Recently, the labor board has issued a complaint, which is also known as an indictment, against the hospital for violation of federal labor law. What the hospital has done is create its own shell corporations and outsource patient care to shell corporations. Patients, your mom, your dad, your loved ones, can't get the access to the care that they need here because of L&M. These people who work at the shell corporations have been interested in joining a union, and the hospital has not been allowing that. This hospital has been engaging in terrible tactics that are seen in corporate America. This should not be seen here in a community hospital. This is a greedy race to the bottom that we see only in corporate America. I'm asking you all today to come out and support us, support the workers, support the people who care for you. Thank you.
All right.
Hi everyone, thank you for coming today. My name is Stephanie Johnson and I'm a mother, I'm a sleep tech, I'm the president of the LPN Technologists Union, and I am L&M. Today I'd like to talk to you. Thank you. Today I'd like to talk to you about what I feel is important, which is the hospital needs to stay focused, the corporation that runs this hospital needs to stay focused on keeping services that are quality here in our community. I have a real problem when we're cutting service programs such as teen pregnancy, the child care safety seats. We're cutting all of these things. We're outsourcing. We're moving our OB clinic, our psych clinic. We're taking them off of the grounds of the community hospital and we're transplanting them someplace else in the community where our patients do not have access to these quality services. That is my biggest complaint, is access to quality health care. As a healthcare provider here at the hospital, I've always believed that I deliver quality services, as do all of my colleagues. We are a union of professionals, and that is what we strive for. Thank you.
All right.
My name is Don Wilson, and I am the president of the Greater New London NAACP, and I am L&M. What I want to talk to you a little bit this afternoon is about the survey that we conducted here in Connecticut on all the hospitals, not just L&M, but a lot of the hospitals fell short of what they should be doing for people who can't help themselves, okay? People who need our help and our support. And that's what we want to talk about, because here today, they're cutting jobs, they're doing a lot of things, but they always start at the bottom, and they start with people who can't help themselves.
That's right.
This here's a copy of the report that we, the Connecticut State NAACP, done back in 2011, and this is a report card on all the hospitals. L&M is laying off workers, changing workers, and so forth today in categories where they don't even support the jobs that they should be supporting. And that's a lot of minority jobs. They don't even support the minority businesses here in the local area. There's a lot that all the hospitals in the state of Connecticut need to improve. Doing what's right for people should be first and foremost on their mind. The NAACP has been fighting wrongs for 104 years. We stand here today with our union brothers and sisters, okay, fighting for what's right for the workers, okay, and what's right for the community. And L&M is not servicing the community the way they should be. And I just want to read to you here the conclusion of our survey. And this pretty much sums it up. It says the data included in this report should serve as a call to action. The way business is being conducted by Connecticut hospitals must change. We in Connecticut must not accept the current reality in which, for example, $100,000 or more of $5 billion procurement funds expended by Connecticut hospitals went to African American businesses in the period covered by this report. The fact, combined with the shortage of African Americans on hospital governance board in senior management positions and as recipients of funds, explain the health care gap in Connecticut. Hospital leaders and policymakers, statewide power brokers, elected officials, and regulators in Connecticut need to step up to the plate and address these issues head on. If they don't, the huge disparities cited in this report will remain and continue to limit the opportunity and to negatively impact the social and economic well-being of the communities where the hospitals are located. And we need all the hospitals in Connecticut to take this serious because we need to repair our communities.
My name is Ocean Pellet. I'm on the State Board of United Action Connecticut, which is a coalition of faith communities across the state working on social justice issues. I am L&M. And I believe that we should support our community hospitals' nurses, caregivers, and healthcare workers when they are advocating for you and me, the citizens of New London and the surrounding towns. I know that Lawrence and Memorial staff are a big part of what has made it a community hospital, and the region has counted on them for generations, and the region has spent a lot of time raising funds for this hospital, expecting it to go to the hospital employees and to patient care. I believe that a great hospital not only provides excellent care, but empowers its staff to advocate for the patients, their families, and our whole community. I share the same values as the staff here at L&M when it comes to holding the corporation that runs the hospital accountable to the community. That is their job.
My name is Lori Pelletier, and I'm the Executive Secretary Treasurer of the 200,000+ union members in the state. And I am L&M. Webster's defines community as those that are sharing values. Well, I hate to say it, but L&M is not a community with any of us here. Last week, hundreds of delegates at the Connecticut AFL-CIO convention supported a resolution, and I'll read the couple of whereases. Therefore be it resolves that the Connecticut AFL-CIO will engage its member unions in any fight by healthcare workers in our state to achieve justice on the job and resist tactics by greedy, irresponsible health management corporations who put profits ahead of quality patient care. And it goes on to say that we will also support the efforts by healthcare workers to reverse inequities in their workplaces that unfairly exclude people of color from advancement and procurement of opportunities. We need better values out of L&M. And on behalf of all the workers in the state, we're so proud of the workers at L&M Hospital for taking on this fight, and we will stand side by side with you because we are all L&M. Thank you.
So that's a bit hard to follow. My name is Melody Peters, and I'm the president of American Federation of Teachers in Connecticut. I am also an executive vice president for AFL-CIO. I was a 15-year worker with L&M, and I see some of my colleagues here. And I also represented L&M in this district for 12 years in the state Senate. When I was employed by L&M, I saw a community hospital that was engaged in its community, that was engaged in its employees and their families. I no longer see that. And I say to you and those representatives from the administration I see in the audience, shame on you. Shame on you for not representing this community to the degree it deserves and to the degree that it expects. Quality care through employing the right people in the right jobs, access so that the community can get the help, the treatment that they need, are primary in this discussion, in this debate going forward. This is a kickoff for I Am L&M. I am L&M. I invite you to join the website, take the survey, join the movement for I Am L&M, because there isn't a person that doesn't live in this entire area that L&M represents that is not L&M. And we need to step up and own it. I'd like to take the time to thank our colleagues, my former colleagues, for joining in this very, very, very important movement. Thank you.